Hello everyone, my name is Jose Flores, an assistant attending at Memorial Sloan Kettering Cancer Center, and it's a pleasure to be here to discuss about penile Doppler sonogram. So a penile Doppler sonogram is a test to evaluate the blood flow in the penis. We can evaluate how well the blood goes into the penis, the arterial inflow, and how the blood goes out the penis, the venous outflow. This information is critical. This information is critical to evaluate for what reason that man is having erectile dysfunction and discuss potential treatment options. And in our practice, we recommend doing these tests, performing these tests, especially when the man is not responding to other medications such as sildenafil or tadalafil, PDE5 inhibitors. A penile Doppler sonogram is performed to evaluate the reason of erectile dysfunction, whether this is due to a poor arterial inflow, not enough blood goes into the penis, or the blood is going, it goes out the penis too quick, that we call a veno-occlusion dysfunction. And that situation is associated with erectile tissue deterioration, or a mix of both. Arterial inflow issues, arterial insufficiency, or veno-occlusion dysfunction. But then also, all the hemodynamic parameters can be normal. In that situation, we discuss with the patients a psychogenic ED, which is related to stress or anxiety. A penile Doppler sonogram is performed in a urologist's office. A small injection is given in one of the sides of the penis. We use a vasoactive agents such as alprastodil, phentolamine, and papaverine. In our practice, we combine those three medications, and then we evaluate the direction that the patient can achieve. We perform the penile Doppler sonogram based on our protocol that we call redosing protocol. So meaning we perform a penile Doppler sonogram only if the patient can achieve a full erections, or we use the full dose of the vasoactive agents. When we're doing the penile Doppler sonogram, we scan the hemodynamic parameters, especially the arterial inflow with the peak systolic velocity and the venous outflow with the end systolic velocity. That information, when we have it, then after that, we have a discussion with the patient regarding the diagnosis and the potential treatments. And finally, the most important, we need to make sure the patient is going to be discharged at home without an erection. So we always evaluate the patients after the penile Doppler sonogram, 20-30 minutes after, to make sure the patient doesn't have an erection that is enough for penetration. If the patient remains with that kind of erections, we do other procedures. Probably the patient is going to need another injection to reverse that erection. Okay, so the most important, discharging the patients, it must be without an erection that is enough for penetration. The penile Doppler sonogram is going to provide objective data that's going to help your doctor with the diagnosis, identify the reason of the erectile dysfunction, okay, and discuss with you potential treatment options, oral medications, intravenous injections, surgeries, vacuum device, and the most important, with this test, identify the reason and discuss potential treatment. You can avoid unnecessary or ineffective treatments. At least in our practice, we always recommend doing a penile Doppler sonogram when the patient is not responding to oral medications. Okay, so if the patient is not responding to PDE5 inhibitors, sildenafil or tadalafil, we discuss with the patients a penile Doppler sonogram as the next step. Actually, at Memorial Sloan Kettering Cancer Center, we consider this test when the patient also is not responding. If the patient is not responding to intracavernosal injections. To evaluate the erectile dysfunction, to evaluate the reason associated with the erectile dysfunction, and discuss potential treatments. In young men, a penile Doppler sonogram, when the erectile dysfunction is persistent or we don't have a real reason why that young population, that young man is having erectile dysfunction, we can perform a penile Doppler sonogram. And also when there is a history of pelvic or penile trauma, the patient is not responding to oral medications, PDE5 inhibitors, or I have a reason to think the patient has some erectile tissue deterioration, venous occlusion dysfunction, or any another vascular abnormality, I would say that patient needs a penile Doppler sonogram. But for many young men, young population, when we know the psychogenic ED is more related to stress or anxiety, a penile Doppler sonogram is not necessary initially. However, it can provide reassurance to evaluate this psychogenic ED. A couple of things that is important regarding penile Doppler sonogram. It's safe, it's non-invasive, except I can say for these small injections, provides detailed information about the vascular status and the erectile tissue condition. It helps to identify between physical and psychogenic ED, and the most important, it can help your doctor to discuss with you the specific treatment that you need, avoiding unnecessary or ineffective treatment, just avoiding wasting time. I would like to say for patients, penile Doppler sonogram is an excellent tool or excellent diagnosis that you can, it must be used to evaluate erectile dysfunction, especially if you are not responding to oral medications. PDE5 inhibitors, sildenafil, tadalafil, before going with any another extra treatment, is very important to know what is going on in the penis. For what reason that man doesn't have a good erection, that man is not responding to oral medication, it must be a reason. And then the penile Doppler sonogram today is a gold standard to evaluate and look for the reason that man is having erectile dysfunction and discuss potential treatment, again, avoiding wasting time, avoiding unnecessary or ineffective treatments.